Here's what I tell my friends and family about egg freezing. I'm Dr. Sharon Moyeri, owner and founder of OC Fertility. One of the first things I want to talk about is egg freezing. This is a very popular topic these days, and a lot of patients, friends, and families ask about when's the best time to consider egg freezing. Certainly the younger the better, but not everybody has the means or opportunity to freeze eggs. So age matters, and we want to talk about why age matters. One, women are born with all their eggs, and so the older you get, the less healthy the eggs are. If you look at the statistics, women who freeze eggs before the age of 35 have a much higher success rate on the order of about 50% compared to women who freeze eggs after the age of 40. Their pregnancy rates for a frozen batch of eggs is about 17%. So freezing your eggs as young as possible is important. So for women freezing before the age of 38, you want to make sure you have at least 20 eggs frozen, and that'll get you about a 60% chance of having one child. If your goal is to have more than one child, then you're probably going to want to freeze more than that. Ideally, if you freeze younger, then you don't need as many eggs to freeze because theoretically your eggs should be healthier. So this is important to consider when you're deciding when to freeze your eggs. So on that note, talking about age and when to freeze eggs, I often get asked, can I wait to freeze my eggs? And so patients will come in and do some testing to see if it's okay to delay freezing eggs. And my answer to that is there's really no test I can do to tell you that you're fertile and that you should wait to freeze your eggs. So a lot of people ask, when should you see a fertility specialist? It really depends on where you reside and what's available in your community. Your OBGYN may be able to do some of this evaluation, but if not, you certainly should reach out to a fertility specialist. Again, if you're delaying getting pregnant, you're on contraception, you probably want to do some background check of your fertility. This is not something routinely recommended. We learn a lot about how to prevent pregnancy and how to manage other aspects of our reproduction. But if you're on birth control pills, for instance, you don't get much information about what's going on in your ovaries because it's masked by the hormones of the birth control pill. So the birth control pill doesn't cause you to decline ovarian function, it just masks what might be going on in the ovaries. So doing some tests like anti-Müllerian hormone or checking the ovaries to make sure that there's still ovarian activity might be a good idea so that you can identify if things are changing in the background. You could certainly do a washout period while you're on the birth control pill to see if there's any signs of changes in your menstrual cycle, but these are the things I would talk to your OBGYN about. Anti-Müllerian hormone can be checked while you're on the birth control pill. It may be altered by the birth control pill, but generally speaking, it can give you some idea if there's anything to be worried about. And that might change your decision making. So I do recommend checking it because you might, one, decide that you're going to come off and try to get pregnant, or two, that you might consider freezing eggs, something you may not have considered doing otherwise. An important point I want to make about freezing eggs is that it's not a guarantee. That's why I always recommend that patients consider using those eggs sooner than later while they're still young enough and still in their reproductive years in case they need to go back and harvest eggs again. This is a backup plan, but it's not a perfect plan. So ideally, you want to use these eggs somewhere in the next 3 to 5 years. Interestingly, we don't see a lot of patients coming back within the next 3 to 5 years to use these eggs. And the older you are when you freeze the eggs, the less likely you are to use them because you've already probably delayed having children and your lifestyle might not reconcile with having a family at that point. But still, I do recommend that if you're going to freeze your eggs, consider, say you meet someone and this is your person that you're going to have children with, or you decide to be a single mother by choice and you're going to use a sperm donor, get to the next step, create embryos, and you can freeze the embryos, but at least when you get to the embryo stage, you know what you have banked, and it's a much higher likelihood of leading to a pregnancy than what you have as a frozen egg. That way you have data and you can decide if it's important to go back and harvest eggs again. The other consideration in freezing younger is that you don't need to do as many treatments because you're using it as a preventive treatment rather than waiting until you're up against a clock. I always compare it to heart disease. You can wait until you're having a heart attack to start thinking about your heart health, or you can start doing some lifestyle changes ahead of time so that you don't end up in that position. So waiting until you're older to freeze eggs is not a great idea because even fresh eggs at that point have a lower likelihood of success. So freezing as young as possible gives you your best odds and results in likely needing fewer treatments.